Hello everyone, welcome back to my channel. Welcome to this Pharmacology Difficult podcast. And today you are welcome to Fast Pharmacology series in which we are going to cover a drug in just 5 minutes. So the featured and the hero drug of today is Ctexli. The spelling starts with a capital C, Ctexli. The C is silent and that's how I call it Ctexli. And this is the brand name. The drug is mainly Chenodiol, and to be more specific, it is chenodeoxycholic acid. It belongs to the class of bile acids. You might have heard about bile acids, and now you're going to know what I'm going to talk about. So this Ctexli, that is easy for me to call, so that's why I'm calling it Ctexli. It is used for the breakdown of the gallstones, and it is used to treat cerebrotendinous xanthomatosis. That is the name of the disease. That is abbreviated as capital CTX. It's a kind of rare genetic disorder, and in this disorder there is a building up of the abnormal fat in the various areas of the body. The common side effects are diarrhea, stomach pain, constipation, changes in the cholesterol level. So let's get to know how does this Ctexli or Chenodiol works. So Chenodiol is a bile acid. When this becomes out of balance in the body, it is naturally made in the body, but when it is out of balance, we have to supply it externally so that the fat is broken down in proper apt amount in the body and it doesn't get built up in the body in various areas. And if this fat builds up in the body, it can build up in the form of gallstones, and that is how the gallbladder disease is occurring, and that is treated with the help of externally supplied Chenodiol, that is Ctexli. The dosage form is 250 milligram oral tablets. Yes, it can be taken orally. There are quite a side effects that are listed for Chenodiol, and the patients may suffer according to their digestive or body metabolism. They can be diarrhea, there can be stomach pain. Sometimes patients can suffer from constipation, liver damage, abnormal liver test diagnostic results, change in the cholesterol levels, headache, high blood pressure, muscle weakness, sometimes infection in the body, in throat area. The serious side effects can be severe allergic reactions. Sometimes liver damage is also a serious side effect, especially if the liver is quite susceptible and weak. There can be loss of appetite, fever, itching, rashes, chillness, white spots on the skin, the urine may turn dark colored, bruising, bleeding. All these are liver damage signs and symptoms. If the person is already allergic to Chenodiol, he or she should not be given this medicine at all. That depends on the proper history taking of the person. Not all types of gallstones can be broken down with this particular medicine, so one should diagnose the type of gallstones very nicely. If the person is having severe gallstones and some other kind of gallstones which cannot be broken down by Ctexli, then the person maybe have to undergo some surgical gallbladder removal, that is cholecystectomy. When does a person need cholecystectomy? Gallbladder inflammation, inflammation of the bile ducts, bile duct blockage, inflammation of the pancreas. So it should be taken only via the prescription. The person should not take by itself. It's not an over-the-counter drug at all. Pregnant women, breastfeeding women should never take Chenodiol. It is not prescribed for them. To be on the safer side, they should avoid this kind of medicine. So what kind of medicine can interact? Antacids can interact, some kind of other bile acids medicines can interact like cholestyramine, etc. A birth control pill, OCP can interact. Warfarin, if a person is on warfarin, that should be detailed to the doctor nicely. All these kind of drugs a person should mention in the history, and they can interact with this Chenodiol. Estrogen, if a person is on some kind of estrogen therapy, then person should tell to the physician, and accordingly the dosage should be adjusted or it should be monitored and supervised. So this is all about Chenodiol, a brief information that I could catch for all of you from latest reliable internet sources. Hope you liked it, and whatever platform you are consuming this episode, if it was useful for you, don't forget to subscribe to my channel and this podcast. At the same time, stay informed, stay curious, stay safe, stay happy, stay enlightened. See you in the next episode with another great information. Thank you.